Hi friends, welcome back in today's video. In this tutorial I am going to teach you how you can treat a recurrent chronic vaginal infections. In this video we shall be looking at how to treat a recurrent chronic vaginal infections or discharge. We have different types of vaginal infections. For instance, we have bacterial vaginosis. We also have yeast infections, that is vaginal candidiasis. We also have trichomoniasis, that is a sexual transmitted infection. We shall see one by one, and each has a distinct clinical manifestations. For instance, the bacterial vaginosis may cause a gray-green discharge with no itching, but the yeast infection, that is vaginal candidiasis, may cause a white, thick, clumpy discharge which may cause itching around the vagina. We also have trichomoniasis. So the trichomoniasis may cause a frothy green-gray discharge that is itching around, which causes itching around the vagina. So we shall see one by one of the drugs. The first drug we have is clotrimazole vaginal gel. So this is a gel in which we use to treat a recurrent or chronic vaginal infections with discharge. We also have azithromycin. So azithromycin, you give 1 gram stat when you are treating a recurrent vaginal infection, together with tinidazole. So this is tinidazole. You give 2 gram stat, a single dose, a starting dose. We also have fluconazole. You give 150 mg stat, a fluconazole. So these are the drugs in which you are supposed to treat a recurrent or chronic vaginal infections. So make sure you combine them: a clotrimazole vaginal gel, azithromycin 1 gram stat, fluconazole 150 mg stat, tinidazole 2 gram stat. What about BID? So we also have a BID. So BID. So this is a BID. BID means pelvic inflammatory disease. So this is infection which affects the fallopian tube. So what about how you can treat is you prescribe drugs, for instances doxycycline 100 milligram BD times 2 weeks. So you give PO doxycycline 100 milligram BD 2 weeks. You also give Flagyl, that is metronidazole 400 milligram BD times 2/52. You give for 14 days. You can combine with PO civexime 400 milligram stat. So this is a starting dose. You give only once. You combine, or alternatively you can replace civexime with IM ceftriaxone 250 milligram stat. So these are the drugs in which you are supposed to treat BID, that is pelvic inflammatory disease, an infection which affects the fallopian tube, the female reproductive system. So this is how you are going to treat any recurrent vaginal infection. Make sure that you also treat with the BID, that is pelvic inflammatory disease, with the following drugs. You either give doxycycline, Flagyl, civexime, or you can replace civexime with IM ceftriaxone 250 mg stat. But for this, you use them when there is a vaginal discharge or itching. Clotrimazole vaginal gel or tabs, you combine with tinidazole 2 gram stat. You also combine with azithromycin 1 gram stat. You also give fluconazole 150 milligram stat. So these are the drugs in which you are supposed to treat any recurrent vaginal discharge, any recurrent vaginal infection, or BID. So thank you for your watching. Have a nice day.